Well, 2023. Hi, everybody. Thanks for watching. This is the Voxsana vodcast, actually, because we're video. I should get that straight. So, what do we talk about on the show? Voice, speaking, writing, singing, because yes, they're all interconnected, and our human instrument. And today's episode is really exciting because it's all about maternity, right? And our changing instrument. So I think that, the guys will get something out of this too if you're supporting your partners, but this one's probably female dominated and for makes sense. But my guest today is my actual doctor. So I'm super thrilled. And without further ado, I'm going to introduce the lovely doctor and bring her on for a chat about our changing instrument, pregnancy. What does that mean for the voice? Specifically, what does that mean for the body in terms of energy levels, the changes that, in coordination, for example, if you're a dancer and you do dance in your shows, if you're a performer, and also too, your general speaking voice, things tend to get a little bit fun during that time. So here we go. Dr. Alicia Power. Dr. Alicia Power grew up in Ottawa, Ontario. After completing her Bachelor of Science in Kinesiology at Dalhousie University, she moved out west, out in Victoria here, to complete, oh, actually, maybe not Victoria yet. Let's back up. Out west to complete medical school at UBC and her family practice residency here in Victoria. She and her husband fell in love in Victoria. Oh, I have not looked back since. She has spent time in Inuvik, which so did I. We'll have to talk about that. Port Hardy and Tofino, but always comes back home. She has been co-head of the Department of Family Practice Obstetrics. Oh my God, she's going to coach me on that word. She's also has a keen interest in teaching our next generation of doctors and is active in teaching both medical students and family practice residents. In her free time, she likes spending time outdoors with her two young kids, exercising, knitting, and enjoying good food and wine with friends. Like, she's pretty rad, you guys. Dr. Alicia Power is the co-founder of She Found Motherhood, supporting people on their journey from pregnancy to parenthood. And she's also a podcast host. So this is voice on all levels. Welcome, Alicia. Welcome, welcome.
Hey, Jill, how are you? I can't
I'm
speak.
good. I can't speak either. What the hell did I say about why can't
Obstetrics.
obstetrics? Okay. Okay.
I have a good
See?
excuse. I was up all night delivering a sweet little baby at 5 a.m. So my word finding skills today may not be quite up to par,
I
but
love that.
that's okay. Yeah,
But your voice
cute.
sounds good, just considering you were up really early. Boy or girl this morning?
A little baby boy. Super cutie
Oh,
patootie, right?
cute. Oh my goodness, and they're so tiny, like, I was always afraid, I'm like, "Am I gonna break them? What's happening?" But you must be so used to it, like, I mean, it's
Yeah, but
probably
it's
still a
still pretty
miracle every
awesome.
time.
Yeah,
Yeah.
yeah. But I do
Well,
handle them with ease these days. So yeah.
yeah, you do. Yeah, you do. Well, welcome. I'm just super thrilled and honored that you said yes today because, you might have been going, "What? Voice? And what's going on here?" But I really went through a lot of interesting and bizarre and maybe some all in my head changes during pregnancy. I'm not sure, but I'd like to demystify this whole process and what it means for voice, even your everyday voice. So I'm not sure where to start, but I think where I want to start with you, Alicia, is the brass tacks of what happens to maybe not our lady bits, but our body in general during the changes of the 3 trimesters. I don't know if that's a huge topic to just jump right in, but let's start there and see where we end up.
We got to start somewhere.
We gotta
So
start somewhere.
let's just start this off by saying I have learned a lot in doing this. I have never thought about voice in pregnancy and the changes
Oh,
because
cool.
I do not use my voice as a instrument. I use it as a tool,
Mm,
I guess, but it's never
yeah,
even occurred to me. So this was a fascinating dive for me. I did a little bit of research.
cool.
There's a lot of terms I have no idea what they mean. So we're
Oh, I love
both going
that.
to get an education today, mostly
Yeah.
me. But yeah, but I'm excited to dive in.
Okay, awesome. So the floor is yours. Take us through as much or as little as you want about the 3 trimesters and what is actually happening in your body in the most layperson terms we can actually share.
Perfect.
Yeah.
And certainly, if you had experiences in your trimesters, jump in and
Mm,
share them with me because
I
honestly, I
will.
often don't even, there's a lot of common things, but this is
Yeah.
a very specific topic. And so it's not
Yep.
something that I've actually thought about that much. So happy to
Cool.
kind of field questions and all that type of
Done.
stuff. So,
Mhm.
our first trimester is generally a very challenging trimester for people. Our bodies are undergoing huge hormonal shifts, and the biggest of those is progesterone. And we are often having a lot of symptoms such as nausea, vomiting.
Yes.
We really don't feel like ourselves in our own bodies. It's starting to make all these shifts. And then we have the anxiety that comes along with first trimester for a lot of people.
Mhm.
So, from a hormonal point of view, progesterone is this fascinating hormone. It's so important. It's pro-gestation, so it really supports our pregnancy, especially in that first trimester. But it can cause a lot of those symptoms. So, what
Mhm.
progesterone does is it slows down your bowels. So, a lot of pregnant people in their first trimester
Oh.
suffer from constipation, right? It
Oh.
slows down your bowels, and it also loosens all of your sphincters. So the sphincter, probably most appropriate for the voice, is that kind of that one that's connecting your esophagus to your stomach. So which if that's loose, it's not really holding that acid from your stomach in, so you're getting some
Mhm.
heartburn or gastroesophageal reflux,
Mhm.
and that can be irritating on the larynx as well. So that first trimester can be super challenging for a lot of people. Some people have super minimal symptoms, but other people really struggle. And then the
Mhm.
fatigue is another thing. Like you just do not have the energy that you normally do. So if you are performing or you're
Yeah.
singing late at night, I can imagine that would be uh, much more challenging just from that kind of fatigue point of view, let alone nausea, let alone vomiting, let alone kind of that heartburn and that reflux affecting your voice.
Mhm. If I can jump in here, is there must be a biological reason for why progesterone causes nausea, vomiting. What is the point to morning, which is actually all day for some people, sickness? What
I know
what is the biological point of that?
it's a good question. And part
Yeah.
of it's not just progesterone, part of it's the beta HCG hormone. So
Mhm.
that's that kind of hormone that's secreted by your placenta when it first kind of starts to form an implant on your uterus. And it kind of
Mhm.
doubles over the first 6 weeks. It kind of doubles every 2 to 3 days. So that can cause a lot of those symptoms as well. So if you have
Mhm.
two placentas, i.e., two babies, then you can often get worse nausea and vomiting symptoms. So it's not only the progesterone, but that progesterone often causes that heartburn and that constipation, which are two of those really big symptoms that people suffer from. I don't know
Mhm.
what the biologic reason is. Makes no
Yeah,
sense. Maybe so that
it
you can
just
rest and
happens.
take it easy and know you're pregnant, right? People also
Oh.
get a lot of breast tenderness and an increase in breast size. So again,
Mhm.
I'm imagining
Mhm.
remember, I've never performed in any way, shape, or form, but if you are
Mhm.
performing and you've got, like, a costume that's tight, you're gonna notice some discomfort there too, so wearing
Mhm.
extra supportive bras, double bras, those types of things is gonna be kind of probably quite helpful there. I'm
This is
making
good
this
tip.
stuff up on the fly.
No, this is so good because it's stuff we don't think about. Yeah, you might need a new bra size. Like, if we you might need a new size. So look, while we're in first trimester, what are some if we have a public speaking engagement or a performance, or we just have a really important conversation with, say, our boss for a raise, right? And we wanna feel our best, but we're in the nausea phase. What are some things, some remedies that you've recommended to your patients to help with those symptoms and kind of make it a little bit more pleasant in first trimester?
So we do a ton of podcasts about this, and we've done a great
Mhm.
one with a dietitian. So I'm going to give you some of the tips that she gave me, so I can take
Brilliant.
no credit for these. Well,
Awesome.
one I do know, and that's ginger. So ginger has been actually shown to help. So Gravol actually makes an organic ginger lozenge that you can suck on, so that can help a bit. The other one
Okay.
is vitamin B6. This is something that we use
Hmm.
in our prescription for nausea and vomiting in pregnancy called diclectin, but vitamin B6, you can take that 3 times a day, and that can help improve your symptoms as well. The
Mhm.
other thing is sour. So sour often helps. So you can
Mhm.
have like a sour lemon candy that you suck on. Putting some citrus in your water can often make it more palatable because one of the things that's really hard is drinking water and staying hydrated in that first trimester, especially if you're having those symptoms. So a little
Mhm.
bit of citrus in your water or lemon flavored water can be really helpful to make sure you're staying hydrated. And then sour apples, so green apples can actually
Yes.
kind of help those symptoms. Green grapes as well. So those are kind of the some of the more kind of quote unquote natural remedies.
Yeah.
Certainly, we also know that Gravol is safe, and so if you're having a particularly bad day and you don't want to be nauseous when you're talking to your boss or you've got a performance, you can also try taking a Gravol. Now that can be making you feel a little bit more fatigued or a little bit more tired. So I would
Mhm.
try doing that before an important performance just to make sure it's effective for
Mhm.
you. but
Mhm.
certainly, and then having snacks throughout the day. So having something in your stomach often helps you feel better. So when we get hungry, when our sugars drop, we can get nauseous as well, especially in that first trimester. And the other important piece of that is to always try to pair a protein with a carbohydrate. So if you have a
Mm.
carbohydrate, you get this spike in your blood sugar, but then you get this big dip. Whereas if you
Mhm.
pair a protein with that, it just keeps it a little bit more level. So things like cheese and crackers, or an apple and peanut butter, or you know, something
Yeah.
like eggs and toast. So generally speaking, kind of bland stuff people tolerate a little bit more in that first
Yeah.
trimester, but trying to maintain your blood sugar so you're not having these big spikes as well.
Mhm. That's so important because a lot of singers, I'll just speak from the singing level, there's such a push to eat so clean and so healthy, and then when you get pregnant on top of that, and you wanna be so clean and so healthy for your baby, and you're eating itchy band noodles because that's all you can eat. So, you said to me something so phenomenal, it's like, "You both are in survival right now, it's cool." Like, can you talk a bit about that and how you disarm that angst for new mamas about eating whatever the heck they can, and maybe it's not salad and green smoothies?
Yeah, so especially in that first trimester, when those symptoms can be really challenging,
Yeah,
you just do the best you can. Your
yeah.
baby is the ultimate parasite. And if you've had good nutrition leading up to it, you're going to be fine and your baby is going to
Mhm,
be fine. So you're right, it's totally survival mode at that point, and you just do the
mhm.
best you can. Obviously, making the best choices you can, but sometimes that's just crackers or Ichiban noodles or mac and cheese, right?
Yeah,
If you
it
can
is.
get some fruit and veg in
Yeah,
there once in a while, or a bit of protein, wonderful, but
yeah.
don't stress out too much about it, because generally speaking, by the time you hit that second trimester, you start to feel a lot more like yourself and you can get
Oh,
back into those healthy eating habits. The other thing that sometimes can help is some people feel really nauseous, and those prenatal vitamins are huge horse pills. They're really big and they've got a little bit of iron in them, and that iron can often trigger our nausea as well. So the most
oh.
important thing in first trimester is folic acid. So if you're taking anything, just take a folic acid. I often tell people to have a kid's chewable vitamin. It's got a little bit less
Mm,
vitamin A. We don't want high levels of vitamin A. So the kids' vitamins have less vitamin A, hence a kid's chewable vitamin.
mhm.
So take a folic acid and a kid's chewable vitamin while you're feeling nauseous, and that's perfectly fine. If you can only take one, just take the folic acid and then restart your prenatal vitamin when you're feeling a bit better.
Right. This is such good stuff. So there's a few I remember my first pregnancy, I had such angst around eating anything because you can Google stuff and there's something wrong with absolutely every piece of food on the planet. You can find information about that and become scared of food. So let's demystify a few things. So, what are the no-fly zone foods for pregnancy and just making sure that your baby's healthy and you're healthy and all that stuff works out? Let's just speak from that and not so much the voice standpoint. No-fly
So
zones foods.
So that's a tough one. There isn't any
Mhm.
real I mean, there's guidelines, right? But there's
Yeah.
no-fly zone. You have to make your own decision. So there's
Yeah.
a really great book by Emily Oster called Expecting Better, and she goes through all of the evidence, like
Oh,
beginning of
wonderful.
pregnancy through to like childbirth. It's
Mhm.
incredible. So our general guidelines are: be cautious in pregnancy. Pregnancy is a
Mhm.
short
Yeah.
period of time in your life, so let's just be cautious and do our best. So we
Yeah.
recommend that all cheese is pasteurized. So it doesn't matter if it's soft cheese, doesn't matter if it's hard, it just needs to be pasteurized. We also recommend that meat and fish is properly cooked. So we're not going to go out for a blue rare steak. Now, in Canada, where we are, in Victoria, our actual health standards are pretty good. So it would be
Mhm.
highly unlikely that we would get some pathogen by going out and having a blue rare steak. But again, we practice an abundance of caution in pregnancy. And so meat
Mhm.
and fish need to be properly cooked. So that includes sushi.
Mhm.
You can have like cooked sushi or veggie sushi, but we don't do the raw fish. And then the other thing about fish is the big fish. So the huge tunas, the sharks, they're at the end of the food chain. So they've eaten all these little animals and collected the mercury through them. So we try to avoid those big fishes in pregnancy. Now you can have a can of tuna that generally tends to be the smaller fish, anyways, once or twice a week. That's totally fine. But avoid those big fishes frequently. Again, if you're going out for a nice date dinner and you want to have some halibut,
Right.
have a thing of halibut. Just don't have it every
Right.
single day, right? So
Right.
there's also kind of common sense and moderation. A
Yeah.
big thing people ask about, and this can worsen reflux, but it can also improve constipation, is caffeine. Caffeine is okay in pregnancy. This is a huge
Okay.
one. Some people don't want to have it. They have aversions to it, that's fine. But if you
Mhm.
want to have your caffeine, You can have 1 or 2 cups safely in pregnancy. It's totally fine. More than that, none of us should be having, but 1 or 2 cups a day is totally fine. I think 200
Mhm.
milligrams of caffeine is kind of the daily recommended allowance in pregnancy. So whether that's tea or coffee, doesn't matter.
Mhm. I love that you hit on coffee, and while we're on coffee, what about coffee and breastfeeding?
Oh, it's totally fine. I
Fine,
would just
yeah.
be I mean, you're gonna absorb a bit of caffeine. I suspect there's some caffeine transference in your breast milk, so but presumably
Mhm.
you're not drinking caffeine at 10 p.m., I hope, right? It
Right?
has huge effects on our sleep,
Yeah,
so
yeah.
generally speaking, I tell people to limit their caffeine to before noon. It actually has a half-life, so a half-life is how long it takes for to get rid of it, of 11
Mm.
hours. So if you're sensitive to caffeine and your sleep is affected by caffeine, you really shouldn't be drinking caffeine after, like, 9 or
Oh,
10
wow.
AM because it's gonna affect your sleep. So,
Wow.
yeah, so that's just something to keep in mind, but certainly if you're breastfeeding, you wanna have a cup of coffee in the morning or 2, great, have at her.
Yeah,
Enjoy
yeah.
it.
This is a big one in the singing world specifically. Is coffee a diuretic? Is it not? Does it dehydrate? Does it not? There's evidence for both sides of the camp. Where do you stand on that in terms of dehydration?
Again, if you're only drinking 1 or 2 cups a day, who
Right.
cares? Right? Really, it doesn't matter. Just make sure you're staying well hydrated. If you're
Yeah.
drinking 6 cups of coffee a day, you're probably gonna be jittery, your heart's gonna be racing, you're gonna have all of
Mhm.
those other symptoms as well. And now some
Yeah,
people just aren't as affected by caffeine as others.
yeah.
But yeah, so it's a little bit of a diuretic, but it's not
Mhm,
gonna make or break you. So if you enjoy your
mhm,
caffeine, have your caffeine and
mhm.
just have a glass of water after.
Exactly. Yeah, 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 the one-to-one ratio, that's what we singers know is, like, if you have a cup of coffee, have a extra cup of water on top of whatever you need, so, um, the anxiety is a big one for a lot of folks and specifically has major effects on the voice when we're anxious or stressed. We start constricting and pushing and forcing, and then we get hoarse. So, if there's any voice specific things that you, from talking to a friend of yours who's an opera singer, that you want to add here before we move to second trimester, let me know. But otherwise, we'll keep going into second trimester and just see
I
what we.
think just managing your anxiety, right? We know
Yeah.
that meditation is really helpful, talking to friends is really helpful, having good sources of
Yep.
information really helpful. Don't go
Mhm.
down the rabbit hole of Google and
Don't
social
Google.
media. That's right. It's
Yep.
there's so much misinformation out there. So find
Yeah.
some good sources, trust
Mhm.
those, talk to your care provider,
Mhm.
and try not
Mhm.
to try easier said than done. Try
Yeah.
not to get too anxious about things. But
That's
yeah,
so true. The books and the Google, it's so wonderful to have all that information, but we have to remember people had babies before this information was available on internet and books. So, and yes, they had their own issues back in the day, but it was successful because there's human beings today. So,
mhm,
you know, don't stress yourself out with becoming a pro on what to expect books, right? I remember a little bit. I had to put them away for a while because it
totally.
was just like, okay, yeah.
And then when you're postpartum and you start to go feed your baby solids and you
Yeah,
go or maybe it's just me down the rabbit hole of baby-led weaning versus traditional and what's better and what's oh my gosh.
and sleep
You
training
know,
and all this stuff, and you're just
there's
like,
no right or wrong answer.
"Oh,
Shades of gray.
no,
Just find the
no."
shade of gray that suits you.
You know your baby. Find something that works. Yeah,
Yeah.
yeah. So second trimester, this is an interesting one because yes, um, a lot of the foods become available to you because they don't look entirely gross anymore. I was completely heartbroken when coffee became disgusting to me in first trimester because that was my crutch when I was tired and I couldn't even look at the stuff. But then second trimester happened and I was like, "Oh, hello, coffee. That you can come back now." So what are some of the changes that we go through there? And if there's any voice related effects, I'd love for you to pop that in where you can.
Yeah, so second trimester for most people feels pretty good.
Yeah.
They get their energy back. Their symptoms usually tend to dissipate, get a lot better. Their heartburn's not too bad. Sometimes it is. So
Mhm.
that obviously would maintain that effect. They're not starting to get really swollen. We'll talk about that in the third trimester symptoms a little bit. So, to be honest, for most people, and I would imagine from a voice perspective as well, second trimester is probably pretty reasonable. So, in
Mhm.
terms of kind of planning, I would plan to be able to do most of what you want to do. Again, we'll talk about this, and I don't know the terminologies, but stick away from the latter edges of your voice's abilities. Don't
Yeah.
push it,
Yeah.
but you should be able to do most of what you do. Now, obviously, your
Right.
body is starting to change. So, first
Mhm.
trimester, especially in the first pregnancy, you're often not showing until kind of 16, 18, 20 weeks noticeably to other people. So your size doesn't change a ton other than the breast size. Second trimester, your physical self does start to shift and change, but you usually feel pretty good.
Mhm.
And so I think that would be a good time. Most people feel like they can get most of what they need to get done. And I suspect that's probably similar
Mhm.
in the voice world as well.
Mhm,
So
mhm.
yeah.
Yeah, and you have so much more energy, so all that stuff that you've been beating yourself up because you don't have this, this, and this, and this in the 3rd trimester, and you're sitting on the couch or the 1st trimester, pardon me, and you're sitting on the couch a lot, just enjoy the sitting on the couch binge watching because you're gonna have more energy, and maybe you don't even have the 1st trimester symptoms, and then way to go you. I think that was your story, wasn't it?
Yeah, I had 2 hours of nausea because my friend who was also pregnant, who was 2 weeks before me, had, like, the worst nausea, and so we were working together in the office, and I was just having, like, sympathy nausea for her, I think,
Oh, cute.
and
Oh
that's
my
all,
gosh.
right?
You're a good
I got a bit
friend.
of acne, but that was a bit about it. My husband diagnosed my pregnancy. He's like, "You got some acne. You don't normally have that. Are you pregnant?" It's like, "Actually, yeah."
Oh, wow,
So the
wow.
other thing to notice
Yeah.
in the first trimester, and I did not talk about this, but this is a really important
Mhm,
thing, and in the second trimester as well, is your blood pressure is naturally lower, and you're going to be
mm.
more likely to faint.
Ooh,
So I suspect,
yeah,
again, I'm making all this up, but from a singing point of view, if you're
yeah,
having kind of long episodes of singing, standing up, compression stockings, making sure you're moving, you're not standing still, you're
mhm,
breathing
mhm,
regularly, I assume
mhm,
you do that.
yeah,
And just being aware of that. So whenever if you're getting up quickly, you might feel more lightheaded. If you bend down and get up, you might feel more lightheaded. So if people are performing, they may need to just be a bit cautious around that. So
mhm,
increasing kind of some salt intake if you don't have any blood pressure problems. Salt and
mm,
making sure you're well hydrated can help. So I have a colleague of mine who every time she was on call in the second trimester, she'd eat bacon before a call shift and some big glass of water
that's
because it
smart.
just it the salt keeps that intravascular volume, so it keeps the volume of blood up inside your venous and
Yeah,
arterial system so it can get up to your
wow,
brain. So that would be
wow.
one thing I would just be cautious around the second trimester is your blood pressure does tend to be its lowest then, and so just being aware of those big shifts from up and down or standing still for long periods of time, so
Wow, that's such good information, and, I love sharing information, and I think the number one thing that you would agree with this too, through pregnancy is not to become hypervigilant to the point of it more anxiety. These are all tips and tricks to help, and if they work, great. If you remember to do them, great. If you don't, great. Just take what works. Would you agree with that?
agreed,
Yeah.
100%.
Yeah, yeah. In terms of workouts, I know that our bodies shift quite a bit during this time. Is this the time to kind of pare back or check in with your doctor, or are we still okay to do whatever workout we were doing pre-pregnancy?
Yeah, so whatever you've been doing, you can keep doing. So if you're a big weightlifter, then you're not aiming for personal best, you're aiming to maintain, right?
Mhm.
If you're, some people train for marathons in their pregnancy. If you feel up to it, go for it. If you've been a runner before, but don't start anything new in
Yeah.
pregnancy. So the one thing that we don't want people doing, I usually say a couple things, but really the only evidence is scuba diving. Don't scuba dive when pregnant. I
Okay.
usually say avoid contact sports, especially as you're in the second and third
Mhm.
trimester. So, and that
Mhm.
includes, horseback riding, especially if you're doing kind of jumpers or eventing, or you have a spooky horse and you're more likely to fall off, those
Mhm.
types of activities. But for the most part, whatever you've been doing, you can continue doing, but listen to your body. If it doesn't feel good for your body, adjust, modify it.
Mhm. Mhm.
Hot yoga is the other thing in second trimester, and that's again the blood pressure thing. So if you're
Yeah.
doing hot yoga, you're more likely to faint because your blood pressure
Mm.
drops in that heat.
Mhm.
So that would be the only other kind of caveat around that. But again, you just do what feels good to your body. If it doesn't feel good, modify it, change it up a little
Mhm.
bit. But there's no
Yeah.
kind of hard and fast. Your doctor will tell you, your care provider will tell you if there's certain things that you shouldn't be doing because of something to do with your pregnancy. So sometimes if our
Mhm.
placenta is covering up our cervix, we advise certain things to avoid certain things. But generally speaking, as long as you're not told to avoid anything, most things are fine and safe as long as they feel good to your body.
Mhm, mhm. So then moving to 3rd trimester, things get fun. And, what can you tell us about obviously we get really, really, really big at that point, and I know for me, I my top heavy and balance was interesting at some point. So, and certain yoga moves were then no fly zone for being on the floor doing ab crunches, for example. So what can you share with us about third trimester, just overall, what happens to the body? What happens to the hormones? Um, I know for me too, with hormones, I'm just going on a tangent here, but my voice changed to this voice. And I don't know if that was tired or acid reflux or hormones or all the above. But anyway, over to you. Third trimester. What can you share with us?
Okay, so this is where I found most of my interesting
Oh, I'm
tidbits.
so
Okay.
excited. I'm leaning
So
up
there
now
was a
with you.
study done in Buenos Aires on
Uh-huh.
pregnant people in the third
Mhm.
trimester. And again, I don't know what half of these things mean, but I'm trusting that you and your listeners,
Sure,
viewers, do.
sure.
So in the third trimester, most people showed an abnormal parameters of auditory perceptual evaluation, a higher incidence of gastroesophageal reflux. I know what
Yeah.
that is. That's that
Mhm.
heartburn.
Mhm.
Predominance of clavicular breathing and a reduction of
Oh,
phonation time.
oh, yeah. 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 We can't get a deep breath, obviously. So clavicle. So chest breathing. It's really, really hard to sing a Whitney Houston song when you're friggin' pregnant. Let me tell you that. You just can't get those big breaths anymore, and it's got to be okay with you. And so you gauge your show accordingly. Maybe you pare down the shows and pull them right back, or you just sing lower in your range. Again, if you're singing properly, you can sing any of your range, but because our breath support is not there and we really need that support, that pressure for high notes, belty notes, that's where we kind of gauge that part. But I love what you found. This is so look at you go. Way
Right?
to go. A plus on the homework.
So we're going to talk a little bit about
Yeah.
swelling because this is a huge
Yeah.
thing, especially in the third trimester.
Yeah.
You get swollen. You get swollen everywhere. Your rings often don't fit. Your feet
Mhm.
are swollen. You can't fit them in
Mhm.
your normal shoes. Your vocal cords also get some swelling.
Mhm.
And this can cause a shift or change in your vocal range. And I think it's
Yeah.
often to a lower vocal range. So that's what
Yeah.
you kind of said. You have like this more like lower
It was
voice
like
in the third
morning
trimester,
voice
right?
always.
Yeah.
Yeah.
Yeah. So
Yeah.
you have that shift. So a big thing is that swelling can also cause blood vessels in your larynx to burst, like my eye.
Oh,
Um,
okay.
and so that can, and you can also do damage to your vocal cords, to your larynx. You can tear them if you try to push it too much. So, like you said,
Okay.
accept that things have changed a little bit. You should get back
Mhm.
to normal, back to your
Mhm.
pre-pregnancy self postpartum, a few months
Mhm.
postpartum.
Mhm.
But don't push it is the big thing, right?
Yeah.
So that's kind of the big things I found around that. And then in terms of that decreased lung capacity, yeah, your baby's up there. It's pushing up there. So not only is your sphincters looser from the progesterone, but now you've got this baby pushing up on your stomach, causing even more heartburn. So that can be a big
Mhm.
symptom that comes up. And there's certainly kind of Tums you can use, and then there's medications we can prescribe. So if you're suffering from
Right.
heartburn, do let us know.
Mhm.
Um, and then you can also get swelling in the mucosa of your nasal
I got that.
passages and your
Yep.
sinuses.
Yep.
And so this causes decreased resonance,
Yes.
difficulty placing sound in the mask.
Yep. Yep. Uh-huh. And a little bit of, like, stuffy like you have a cold all the time.
Cold or
So your
allergies,
voice
that's
yeah,
kind of same thing. It's just because everything's swollen in
yeah,
there, like it is everything
yeah,
else. You can't do anything about it. So you just
yeah.
got to accept it,
No,
be
you can
okay
use
with
all
it.
yeah, you can use all the tools and you'll get like, if you do some extra warm up, you will get, less of a hoarse morning voicey sound. If you do some steam and stuff and make sure that the hydration's there, that helps too, but like Alicia said, like, it's swollen. It's swollen.
And it's not
So,
swollen from
yeah,
inflammation. So if you have
yeah.
allergies or you have like a sinus infection, you can use a nasal steroid spray to decrease that
Mhm,
inflammation. But if it's
mhm,
not because of inflammation, it's just because of swelling because you've got extra fluid everywhere, those
mhm,
types of things aren't going to help you,
mhm,
right?
mhm.
So,
Yeah.
yeah. And then the other thing, and you kind of alluded to this, is kind of your posture and your balance. So
Yes.
as our body's preparing for birth, we release a hormone called relaxin. And what relaxin does is it relaxes kind of our ligaments that are and tendons that are kind of in and around our pelvis. So our pelvic floor shifts and open. We have this big belly in front of us. So our whole posture is different. And the how we find our way in the world is a bit off kilter. So our balance is a little bit off kilter. All of our kind of joints are a little bit looser. So you're going to find you're more flexible, but you're also a bit
Mhm,
more prone to injury. So just being really
mhm,
cautious around that if you're performing.
mhm.
Um, And so those are kind of some of those things. Now, this is where my friend said sometimes
Ooh.
being pregnant can be good, because she said, this is my friend who's an opera singer. She says that heaviness in your pelvis, you can actually use it to kind of use that kind of weight to sing really deep down. I've never sung deep down in my life.
Oh,
And maybe
okay.
that's more in the second trimester when you still have some lung capacity. You can
I
kind of
think
focus that kind of your pelvic floor down.
yep.
So that's, she was trying to find a silver lining for us.
You're very
So thanks,
aware of that.
Mamie.
Yeah, that's wonderful because it takes away the chest breathing and thinking about your voice from, your this as it becomes this. Like, you're
Mhm.
very aware of that midsection. So, yeah, I totally get that. That's really thanks,
Yeah.
friend.
Right?
Wow. That's
And I
so good.
imagine something that probably I often didn't think of this before I started doing these podcasts with my amazing physiotherapy colleagues.
Mhm.
And I imagine, maybe I'm completely wrong, that people who use their voice as an instrument don't think of this, but pelvic floor physio is probably going to be something that is incredibly important to people who are singing and performing. It's so much about your core strength. It's so much about your pelvic floor, which is so intricately involved in
Mhm.
deep breathing.
Mhm.
And so I think for people who are using their bodies and their voices as a tool, really engaging in pelvic floor physio early in pregnancy and going at least once a trimester just to kind of get those tips and tricks from those amazing pelvic floor physios are great.
Mhm.
And then from a pushing point of view, you also want to make sure that you're not hurting your vocal cords when you're pushing,
Ooh.
um, right?
Yeah.
Because
Yeah.
some people kind of are really grunty and guttural, and I would imagine you could do some damage
Yeah, and
there.
a lot of strain here too.
Yeah,
Yeah,
and
yeah.
so they can certainly help you learn a few different options of how to push if you're planning for vaginal delivery,
Mhm.
that would help you to kind of maintain the safety of your vocal cords.
Absolutely. Yeah.
And then postpartum, as you're recovering, they can really help you kind of get back into that re-engaging of those core muscles, get your core strength back, because I would imagine that's a huge piece of singing and
Yeah.
performing, is having
Yeah.
that really solid core strength and that really kind of connected pelvic floor and diaphragm movement. And so they can really kind of
Yeah.
help guide people through that postpartum recovery, because
Yeah.
one of my colleagues equates it to the biggest musculoskeletal injury you ever have, right? If you sprain your
Wow.
ankle, you're gonna rest it, you're gonna ice it, and then you're gonna start rehabbing it. We have a
Right.
baby, we don't rest, we don't
No,
ice,
we don't.
and we don't rehab. We think we're just gonna bounce back to what we were before,
Yep.
despite the
Yep.
fact that we've had 9 months of stretching our bodies out, doing all kinds of
Yep.
crazy weird things. We have to rehab as well, so
Mhm.
and I imagine
Mhm.
that's the same thing with your voice, right? You have
Mhm.
to kind of rehab your voice
The
back to where it
hormones are
was
still
and not
going. Yep.
expect it. Yeah,
Mhm.
totally.
Mhm. Mhm. There's so much to unpack in the postpartum because, the abs for sure. It's all connected. We talk a lot about it on the show, and this is not just my philosophy, it's a lot of vocal coaches out there. It's a human instrument. It's all connected. When one thing's off, the other thing's off. The rest of it's off in minute ways or obvious ways. So when the abs aren't working right, that's a very close to everything we need for singing, right? And some of them actually are helping, um, with the breathing mechanism. So the diastasis recti, am I saying that right? Because that is something that after the C-section, mine weren't working right. So can you talk a little bit about that? And does that also happen with vaginal deliveries? Yeah.
Hundo P, as the kids say. Yes,
Oh,
so
wow.
diastasis recti is basically the step where you've got your diastasis muscles, which are your up and down, your six-pack muscles, not for me, but for some people, six-pack muscles, and they're connected in between the two muscles with some fascia or some connective tissue.
Okay.
100% of pregnant people by the end of their pregnancy have diastasis recti. Period, end of
Mhm.
story. So how you know if you have it is when you go to sit up and you have that tenting or that mountain of your abdominal muscles. So that's
Mhm.
diastasis recti. Some people have it more severe and some people have it less severe.
Mhm.
So it can happen regardless if you have a C-section or a vaginal delivery. It's as a result of the pregnancy. But the case is, does it last postpartum? So our
Mhm.
muscles are very much stretched out. You think about what they had to do to accommodate a baby. It takes some time for them to get back to their right spot, right? So we have to
Mhm.
be patient. So people often don't think, but you have a jelly belly. I call it a jelly belly lovingly.
A lot longer than you
Afterwards,
think you will. A lot
right?
longer than you think you will.
Yeah, some
Yeah.
people comes back quickly, and some people
Yep.
it takes some time, and that's
Yep.
fine. There's nothing
Yep.
wrong with that. That's just
Yep.
how your body works. And you want to be careful not to really strain those diastasis muscles specifically when they're coming back, because that can actually make the diastasis worse in that kind of
Ooh.
postpartum period. So it's, if you are, 4 weeks out and you're still suffering from a diastasis, like every time you get up, you see that separation, or you can sometimes, if you flex your muscles, you can feel a space in between your muscles. Go see
Mm.
a pelvic physio. They will help you. So
Yeah.
rotational exercises are really good postpartum. Just those deep breathing exercises to rehab your core and reconnect everything are so important. That is all you need to do for the first 2 weeks, is just those deep breathing, reconnecting your core. But certainly some people suffer with diastasis for a lot longer.
Mhm.
And partly that's because we don't talk about how to rehab it, right?
Right.
And that is an important piece of the puzzle. So it can complicate some people's postpartum, not
Mhm.
everybody's.
Mhm.
But certainly if it is a challenge, pelvic physio is your best friend for that.
Yeah. Is this something that corrects itself as you go on in life, or are there people that have had, babies 10 years ago and still suffer from
Mhm.
this?
There are
Yeah.
people that suffer
That's
from
what I
this
thought
for a
I
long
heard.
time. So I had
Yeah.
a friend, she had a four-finger diastasis, so she could stick her, and she was an athlete, like, she was a runner, she ran marathons. She could stick
Aw.
her whole hand into her
Mhm.
diastasis, and then she started actually doing proper rehab for it, and she got it down to 2 fingers. So it improved
Mm.
dramatically, and she has
Yeah.
much better core support now, right? So it can improve and you can rehab it. Sometimes it never gets 100%, but the vast majority of people recover from it, and it doesn't cause them issues long term, especially if they've taken the time to actually properly rehab it if it's been bothering them 4, 6, 8 weeks out.
Yeah. Wow. Um, okay. We just got notice that we had stream issues, but I think we're okay. Hey, everybody out there. If you can still see us, yay. This is such an important one because a lot of women can get on themselves about, "Ugh, if you go online, it's everywhere, mommy tummy." And I don't know how I feel about that. It's kind of insulting because it's like, okay, we just birthed a human. So, chill out about that. But if you are, what was happening to me is I was all back to my pretty much my regular size. It's just I had a bunch of poof at the front
Like
and
your
part of
stretched out skin,
separation. And so, yeah, yeah, so a lot of that.
what are you gonna do? You
So
had a
for
baby. I mean,
you have
honestly,
stretched out.
y
Yeah.
right? Your body changed dramatically. It grew a human being inside of it. It's
Mhm,
incredible. If you think about
mhm,
what your body did for you to grow and birth this human being, however you birthed that human being, like,
mhm.
it's never gonna be how it was before.
No.
Period, end of story, and that's not a bad thing. That's a pretty incredible thing, right? I'm not
Right.
saying it's not hard to adjust to that, but I think you're right, social media, and there's so much pressure to kind of get back, and some people do. Some people, you see them and they have this, like, phenomenal body 6 weeks later, and you're like, "Who the heck are you?" But that's
Yeah.
not typical, right?
No,
That's not typical, and
no.
maybe there's something else going on in their life that they're hiding, and so we can't just assume everybody's got this great life, and those people who bounce back, maybe they're solo parenting and they can't eat and they've lost all of this weight because they can't manage on their own and they're
Right,
stressed to the max, but woo, they
right,
got a rocking body. Like, so I
right.
think we just have to be we are all our own individuals. We're all
Mhm.
on our own journey.
Yeah.
Our bodies have done this incredible thing. And, there's a term called the fourth trimester or
I love
matrescence,
this. Please
right? The
talk about
fourth
that.
trimester is those 3 months postpartum up till,
Mhm.
and that is, you're still intricately connected with your baby. A lot of women
Mhm.
hold on to body fat while they're breastfeeding. So they don't kind of lose those last 5, 10 pounds until they're done breastfeeding, because our
Mhm.
bodies are made to store fat so that we can create this nutritious, healthy milk to feed our babies, right?
Mm.
Um, there's also kind of a C-section kind of shelf, I guess the term is, I'm not sure. And sometimes if you have a C-section, your skin incision can get kind of scarred down to the fascia, the underleaf. So you've got a bit of fat in between. But for people who sometimes those layers get scarred down, and so you can get this indentation. So scar
Mhm.
massage, cesarean scar massage is great for that. And you can do that at any point postpartum after kind of about 6 weeks. If you're
Yeah.
8 years out from your C-section and you still kind of just feel like you've got that adhesions there or that scar tissue there, you can do cesarean scar massage. And there's lots of people kind of showing
Wow.
you how to do that. So So I
Mhm.
think there's a lot of things out there. There's a lot of pieces to it, but
Mhm.
certainly, our skin stretches out. You can't do much about that unless you go get plastic surgery. So every time you do a plank, you're going to have this loose skin because that's just it's stretched out. And unless you're 22 years old, it's not going to go back to where it was, and
Right,
that's
right.
okay, right?
Yeah,
But yeah, it is. It's a huge adjustment. It's a
it's
huge
a huge
adjustment.
it's a
There's
huge
so many
adjustment.
changes, right?
Yeah, yeah, and especially not especially, but in a different way for performers, they're on stage, they're being looked at, and they have a lot of judgment about how they look and are they back to their form, and if we can just take one blanket statement for our conversation and say, "Stay in your own lane, don't compare, just find your best self in what you're doing and without the angst, right? So whatever works for you the best, without the judgment of yourself. It might take you longer, it might take you shorter to heal and feel like yourself again. And I use that loosely because you're still yourself, but just feeling back to your regular energy, that kind of stuff. And plus, you have a baby that may not be sleeping.
Gonna say,
So
are you feeling back to your energy, regular energy? Because my kids are 8 and
I
10, and I'm not yet, but that's
I'm
okay.
I have glimmers of it. It's what the gift is that you completely forget what the hell it feels like while they're tiny and screaming all the time. So
Yeah.
it's not like it's just there one day and gone the next. And especially in 3rd trimester, I noticed I wasn't sleeping as well. It was
Mhm.
weird. I was waking up in the night just like wide awake, staring around.
It's a cruel and
So
unusual joke, isn't it?
yeah, but
Um,
it's a transition so you're not like, "Holy god, what's happening? The screaming baby and I'm not sleeping." Like,
yeah.
go
So
ahead. You were gonna say
you were
something.
saying something about not worrying about what other people are thinking of you and
Mhm.
not worrying about their judgments. And I don't know if you've read Brene Brown, and I'm really
Mhm.
horrible with quotes, but she
Mhm.
says something about, you know what, if they're not in the arena with me, I don't care what their opinion is. If they
I
get in
love
the
that.
arena with me and they get up on that stage and perform and then they have something to say with me to me, sure. But if you are judging me and
Yeah.
you are not in the arena doing the hard stuff with me, I don't
Yeah.
care what you have to say.
Yeah.
Right? And I think
Oh,
that's really important is people will judge, people will talk, people will complain, people will make all kinds of comments.
yep. Yep.
But the big thing is, do you actually care what they have? Do you care what their opinion is? And for the
Right.
most part, I think the answer is probably no. You care about
Mhm.
your loved ones' opinions, your friends, your mentors, the people that you
Mm,
respect. They're not the
mhm.
ones who are going to make making these comments because they
Mhm.
know the amazing journey that you've been through and they know
Mhm.
the amazing journey that you've done to get back up there, right?
Mhm. 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 And that's a big one because people are gonna fly opinions at you when you become a mama. Opinions and opinions and opinions. Even if you don't birth your baby and you adopt a baby, people are gonna fly their opinions at you. There's just something about being a parent.
Mhm.
So you gotta weigh those with a grain of salt. And yeah, if they're not in the arena with you in that exact situation, they don't know their advice is just speculative. So,
Yeah.
um, can you talk to us about because this is where the postpartum is the and I know this is hard because it's case by case, but the line between, hey, your hormones are just going back into alignment, so you might feel a little off, a little moody, and oh my, we're in postpartum depression or anxiety. What is the line for people to look at? Because this is huge, and a lot more people are talking about this section of time in your lives, and a lot of celebrities are now talking about it and making it well known. It's a real thing. It's not just baby blues for a lot of people. What can
It's
you say to that?
huge. It's huge. So
Yeah.
baby blues is kind of when you're getting these overwhelming bouts of emotion. Usually in the first 5 to 7 days, you're overall happy, you're enjoying your time with your baby, but then you suddenly start crying or you suddenly
Mhm.
get really upset about watching a TV show or a commercial. Like it
Mhm.
really just hits home to you. But then you're okay
Mhm.
again, right?
Mhm.
Postpartum depression is, something that lasts 2 weeks or more. You're feeling more down than you are up. You're not necessarily enjoying your time with your baby most of the time. You're struggling with motivation. You're struggling to kind of get out of bed in the morning. You're struggling to kind of do the basic needs, bathing,
Mhm.
clothing. Now, sometimes just getting a shower in is hard with a newborn baby,
Yeah.
but
Yeah.
it's not because of a time thing. It's because you're not interested in doing it. You're not interested in reaching out with your friends. So that's kind of that postpartum mood
Mhm.
depression. Postpartum
Mhm.
anxiety, I think, is way more prevalent, way more common than we even thought.
Mhm.
And so this is, overwhelming fear around your baby's health, or your partner's health. This is overwhelming fear about, in the time of COVID, like is so hard. Like, am I gonna die?
So
Is my
hard.
baby gonna die? What
Yeah,
if I invite my mom over? Is she gonna give my baby COVID? Like,
I
just
know.
these kind of ongoing
Mhm.
thoughts and concerns and fears that you can't get out
Mhm.
of your mind. Something we
Mhm.
really don't talk about enough is intrusive thoughts. So, intrusive
Mm.
thoughts are these unrealistic thoughts that just come out of nowhere. They're often about something really bad happening to your baby. If you're, huge fear of driving, I feel like for some reason I've never
Yes.
gotten in a car accident, but if I get in the car with my baby, I am going to drive off the road and we're going to both die. Like it's never
Yep.
happened before. The likelihood of it happening, but it stops you from doing the things that you would normally do.
Mhm.
And so, or, my baby's going to drown in the bath. I mean, there's healthy intrusive thoughts and then there's
Yes.
unhealthy. So you don't bathe your baby, even though you're going to be there the whole time. They're not going to drown. You just don't bathe your baby because you have this like overarching fear that these things are going to happen. So there are
Right.
normal intrusive thoughts and then there are dysfunctional or abnormal intrusive thoughts. And so
Mhm.
anxiety often presents as those intrusive thoughts. It's that just kind of repetitive, really worrisome, really makes no sense, but you can't talk yourself out of it and it stops you from doing the things that you want to do.
Mhm.
And so
Mhm.
certainly those are things that you need to talk to your care provider about. So those baby
Mhm.
blues really often don't last more than the first week.
Mm.
So outside of that is when we're
Yeah.
kind of going into that postpartum depression, postpartum anxiety piece if
Mhm.
you are struggling with those symptoms still.
Mhm. And both pregnancies for me weren't the same in all the symptoms. Some of them were, the same, like the heartburn was the same, the nausea was the same, but the postpartum was not exactly the same. And so that's something for women to watch out and their support partners to watch out for is it's not just because the first one went well. The second one, we can kind of I know for me with my son, I didn't have as many intrusive thoughts that were dysfunctional that I did with my daughter the second round. And I downplayed that, like, "Oh, it's fine, it's fine. I was fine my first pregnancy, and this one, oh, I'm just," but it wasn't. There was a point where, and I shared this with you in one of our appointments, I was scared to get in the car and drive somewhere because I had a feeling we were going to get into an accident. It was just out of nowhere. I walked down the stairs to my car in pure joy, excited to go on a drive with the family, and out
Mhm.
of nowhere, it was like, "We're not going. Nope, nope, nope." Um, who knows where they come from, but they feel very real in the moment, and it's important for your people around you to catch that and go, "Wait a minute.
Yeah,
That's
and for you to have
that's"
that support around you that you can
yeah.
talk about it and feel safe talking
Mhm,
about it, because oftentimes once you start talking about it, other people start
mhm.
talking about it, and you realize you're not the only one, and then you're
Right.
like, "Oh, okay. Well, I'm not the only one. This is obviously something.
Yeah,
Let's start working
yeah.
on it." Rather than thinking you're the only one who ever thought like this, and then
Mhm,
isolating yourself because you don't want other people to know that you're having these thoughts, right?
mhm.
And there's lots of support out there. There's, postpartum counselors who are specialized in this. There's group in Victoria, we've got group CBT or cognitive behavioral therapy kind of
Mhm.
postpartum groups. We've got
That's cool.
medication, we've got one-on-one kind of psychotherapy. There's lots of kind of supports, especially if you have extended benefits. That makes a huge difference, obviously. But
Mhm,
just a simple thing of talking to a friend about it who's
mhm,
probably been through it if they've had a baby, because every
mhm.
postpartum person has had an intrusive thought. They may not have been dysfunctional, they may not have been postpartum anxiety, but every single
Right.
person has had at least one intrusive thought.
Mhm.
I always kind of laugh with my husband because I would notoriously have a dream, some horrible dream about my children running out the front door and getting smucked by a car. I would wake up in the middle of the night, I would elbow him and I'd say, "You need to do something about that front door, make it so they can't get out in the middle of the night." Next morning, he'd get up, he'd go, put a latch on the top of the door, and then it
Yeah,
was fine, right? So
yeah,
my intrusive
yeah.
thoughts weren't dysfunctional,
No.
they were actually functional, probably not necessary, but functional.
Right.
But I had them and I didn't have
Yeah.
postpartum anxiety, right? So
Right,
everybody gets
right,
it. Everybody who's had a baby has had at least one intrusive
right,
thought. So just having those conversations can
right.
be so therapeutic.
That's a big one, not pretending that I'm back to normal or whatever that means, right? It's okay if it takes longer for you for your moods to stabilize. It's okay for you if your body takes longer to stabilize. It's okay for you if you can't get your voice back into the shape it was pre-pregnancy. Um, it's okay, but because it will if you keep at it and you give it time, things will come back and you get the support that you need,
Mhm.
right? If you don't get support and stuff like the postpartum depression, we shouldn't wait it out, right, Alicia? We should reach out.
Correct.
Or if you can't reach out, the reflection of those loved ones is very, very important. So
Yeah.
we could talk forever about this, but I need to be mindful of your time. So we have about 5 more minutes. So there's a few things I want to hit with you, unless there's something absolutely pressing that you want to share with me from your awesome research that you did. Is there anything that we haven't hit on that you found really fascinating about voice and pregnancy?
Okay, third trimester,
Okay.
a significant decrease for voice turbulence index. What does that
Oh,
mean?
you know what? That's beyond me. So I'm I was gonna say I'm gonna Google it. We just told people not to Google, so I might Google it. Turbulence
Significant
index.
increase for fundamental frequency, maximum phonation time,
Oh,
and
yeah.
vocal
Yeah, yeah.
intensity, and a
Yeah.
significant decrease for voice turbulence index. There you go. That's all I got.
Turbulence index. That's phenomenal. This is so interesting. I mean, it's all connected, right? What's the song? The knee bone's connected to the shin bone. I don't know. It's all
I think that's
connected.
correct,
So
though, yeah.
it does, and I always preface that with people because when singers find out about all this information, they get hyper vigilant. That's the first thing. Oh my god! Oh my god! Oh my god! Oh my god! My instrument's going to be wrecked. No, it's all connected in the very best way. So if you've got healthy everything else, everything else will come and be healthy as long as you give it time and space and the appropriate support. Water. Let's talk water because especially when breastfeeding, making a baby, do we need more water? Same amount of water? Is there too much water? What are your thoughts on that?
Yeah, so you're increasing the need for water because you're feeding your human being your
Hmm.
water, essentially, right? You're creating all this breast milk. And so you need to increase your water intake for sure.
Yeah.
So what I
Yeah.
usually say to people, if they ask me, is have a bunch of water bottles, like create some stations, especially if you're going to be breastfeeding or bottle feeding,
Love
create
that.
some stations, a few places that are comfortable that you're going to go and you have some snacks there. You've got a couple of bottles or like water bottles there full of
Hmm.
water. And then your partner, if they happen to be walking around, a super helpful thing they can do is refill the snack stations, refill the water bottles, and then just have
Oh,
those few different areas that are comfy, one in the living room, one in the bedroom, whatever, one in the TV. I don't know how many rooms people have. I don't have that many. But just creating those little kind of comfy, cozy, have what you
yeah.
need, maybe a few diapers, your breast pads, whatever you kind of need, and create those
Awesome.
little stations so you can have everything ready to go. Because sometimes once you start a feed, you're stuck there for like a good hour, hour and a half. There's no
Yeah,
getting
because
up.
baby sleeps and you're
Yeah.
not putting baby down because baby's
No,
waking
because you
up.
don't want them to wake up, right? So you're
Yeah.
kind of stuck there. Have a pee before you go feed,
Yep, yep, I always
just in
do
case
that. My
it's like,
husband's
yeah,
like, "Where do
right.
you go?" Like, you say you're gonna do something, and then you're gone doing something before you actually do it. I was like, "I'm
Yeah.
going pee."
You got to prepare. You got to prepare for the hour and a half marathon that
Yeah,
is booby juicing. Yep,
yeah.
correct.
You said something
Hmm.
really interesting. There's a few things that we should be aware of, especially if we're in the public eye, the breast pads and bladder control.
Hmm.
Can you tell us
Hmm.
a little bit about what happens there, what can happen that might feel, you don't want it to be on display, and, what are some solutions there?
Okay, so let's talk about breast leakage first. So when you're breastfeeding, you have what's called a letdown. So that's a time that your breast actually like jettisons the milk out of your breast. So that often will happen around the time that you're supposed to then next feed your baby. Some people get like a tingly sensation. Some people have a bit of a
Mhm.
warning, but you're going to have some leakage. Another time it happens is if your baby starts crying
Mm.
or another child starts crying. So you can
Mhm.
get these reusable or disposable breast pads that you just put in your bra. And some people are actually starting to leak colostrum in their pregnancy, like in the third trimester. So you can use them there then as well.
Mhm.
And then so just that you're not kind of leaking through all of your clothes. So that's a really
Mhm.
good thing.
Mhm.
Postpartum, you're going to bleed for a while. So I usually say
Mhm.
get some of those like depends old lady diapers or Knix,
Yeah.
Knix, like Knix actually
Yeah.
has they've got some great breastfeeding stuff and some
Cool.
great kind of postpartum absorptive underwear.
Yeah.
So get some of those and be prepared because you're going to have bleeding for up to a couple of weeks really afterwards,
Mhm.
and create like a little station in your bathroom, right? With your Tux hemorrhoids pads, your witch hazel pads, your peri bottle. That's what you use to clean. If you've had a vaginal
Mhm.
delivery, kind of used to clean. So that's really important. And the other thing
Mhm.
is kind of you alluded to is kind of that postpartum. Again, it's the pelvic floor, right?
Mhm.
So pregnancy puts a ton of pressure on the pelvic floor. I'm going to cough, excuse me, sorry.
Yeah, no problem.
Pregnancy puts a ton of pressure on the pelvic floor, and that stretches the pelvic floor out. So regardless if you've had a cesarean section or vaginal delivery, you could certainly have some changes from that. Most often, it's a result of a vaginal delivery because a baby kind of pushes through the pelvic floor and stretches it out
Mhm.
significantly. So
Mhm.
again, pelvic physio, amazing for rehabbing that pelvic floor and strengthening those muscles up again, and getting them back to where they should be. But some people do suffer
Mhm.
from postpartum incontinence,
Mhm.
despite really good pelvic floor physiotherapy. So there's a couple of options if you do. So if you're running or jumping or dancing, and you are having urinary leakage or coughing,
Yeah.
you can use something called a pessary. There's one on the market that you can just order online. It's called Uresta, Uresta. It comes in the starter pack, and there's 3 different sizes. So
Mhm.
you put it in your vagina, and it just supports your urethra. So your urethra is the tube that drains
Oh,
your bladder, and so it
yeah.
just supports that. So you need more pressure to pee, right? You need more
Mhm.
pressure to overcome that kind of support from the Uresta. So that can
Mhm.
be really helpful as you're rehabbing your pelvis or as an augment to that. So, for runners, they'll just put it in when they're running and then they'll take it out afterwards and they don't need it anymore. Or if
Mhm.
you're, performing and dancing, put it in when you're dancing, take it out when you're done.
Yeah.
Yeah, but pelvic floor physio is the mainstay treatment. Again, also
Yep.
rehabbing that whole core. But that's one
Yep.
other tool that some people haven't heard about that can be quite useful postpartum.
That is super awesome because I mean, it's happened to, I'm not gonna name her name, but a very famous singer had, the incontinence on stage and was raked over the coals, and you know, I don't think we need to rake anybody over the coals for that. She had a baby.
Yeah,
So,
totally.
2 thumbs up
I
to her.
suspect there's been some men who've had some incontinence on stage too, and
I'm sure
we probably give them a, "Hey, okay," for that, right? Like, it's crazy. It's crazy,
Oh, life is fun. Oh, we have a
isn't it?
chat, a quick chat. So I'm gonna read. Oh, look it, it's my lovely husband. Just gonna. I remember Sean Mitchell. I remember having to put a lawn chair at the top of the front stairs. Yes, I was so afraid that our son was gonna run out the door and fall down this huge flight of stairs. So he put a lawn chair because we didn't have a fence or a gate, and it was late at night. And I said, "Can you just put something? I just need you to put something." So this is back
Yeah,
to that,
Sean, that's where I sent my
postpartum.
husband to put the latch at the top of the door so my kids can
Yeah,
get out in the middle of the night. Not that they ever
yes.
did.
So this is a really good question and, probably one of our last ones here. Does Dr. Power have suggestions for spouses to seek out resources that will enable us to be more educated as support people? Yeah,
Yeah, so I'm
that's
not
awesome.
promoting my course. Any kind of postpartum prenatal.
Please talk about your course.
So we have a prenatal course. It is 8 hours of modules, and there's a huge amount of the postpartum and newborn care. And that is definitely something. I mean, I think both people should watch all of it because often in the labor part, the partner is the one who is kind of the major support person and has a good understanding of his or her partner's wishes in
Mhm,
labor and childbirth, right? But the postpartum has a ton of information on how to support with breastfeeding and how to do newborn care and all of those pieces of the puzzle, diapering, et cetera, et cetera. But
mhm,
any good prenatal class will have a good postpartum kind of support element to it. And I
mhm.
think that is a big one. There's a couple of great books. I don't have them. I don't know what they are off the top of my head.
We could pop
Um,
them in the show notes too if you wanna send
yeah,
those to me
I'd
email.
have to
Yeah,
Google them. I think
that's fine.
and in Dad's Bible to I don't know, pregnancy, I don't know what it is. And there's a couple great
That's
podcasts out there too that are pretty funny.
speaking of podcasts, you
Yeah.
have one. Do you wanna talk about that?
Yeah, so we do
It's
that. Oh my
really
gosh, look how
phenomenal.
organized you are.
I know.
Um, She Found Motherhood podcast. So I think we have
Yeah.
150 something episodes, and it's all kinds of topics around fertility,
Yeah.
pregnancy, postpartum, newborn care. We often have
Mhm,
guests on, so allied health providers, oftentimes. We do some birth
mhm,
stories as well. So I've learned a ton from people on that, pelvic physios, dietitians,
mhm.
social workers, counselors, all kinds of stuff. So that's been really fun and helpful and a great resource as well if you have questions, because we've got pretty much
Yeah.
every question you can ask. Well, except for the voice
Well,
one.
I'm totally going on and watching the, dietitian one for sure because I find that fascinating, and that's a big one for a lot of our, viewers is, how do we eat to support that voice, but also what do we do in pregnancy? So that's awesome.
Yeah.
There's lots of ways to connect with you. So I've got socials for YouTube, Twitter, and Pinterest at She Found Health.
Oh, yeah, we're
Facebook
never on
is
Twitter. I don't
okay.
know how to
I
tweet.
don't know anybody that's I don't know either. My dad's on Twitter, and he's not even my friend because I'm so not on there.
So
But
funny. Yeah, we're
you're on
most
Twitter?
active on Instagram. So at
Okay, perfect.
she.found.motherhood at Instagram. Every Sunday we have a
Okay.
Q&A so people can
Oh,
submit questions and we'll answer them. And then our
oh,
podcast
brilliant.
is obviously a good resource. Yeah, and then
Awesome.
we've got our website, it's shefoundhealth.ca,
And on
so
your website, you can get that podcast in multiple platforms. So there's links there for everybody. So this has been awesome. My last question for you, because this is always the biggest question, is when is it safe to start your workout again after you've had baby and whether you're vaginal or C-section? What is the recommended, aside from tune into your own body and know your own body? What's the
so
doctor recommended
so for
wait time?
C-section, we say 6 weeks. So we need 6 weeks to really let that fascia, that connective tissue heal
Hmm.
underneath the incision. We
Yeah.
wanna make sure that's well healed before you start straining it.
Hmm. Hmm.
So 6 weeks for cesarean section, and then remembering you probably haven't been doing what you used to do, so start slow and then ramp up. For
Hmm.
postpartum vaginal delivery, it's kind of a listen to your body. So,
Hmm.
if you feel like going out for a walk, so a week or 2 postpartum, just start slow and slowly increase it and see how you do. Running is
Hmm.
the big thing, 3 to 4 months for running. You should be able to do a single leg squat and a single leg calf raise before you start running. Running is a single leg sport, so you need to have your strength back to start running. So at least 3 to 4 months postpartum, and if you're
Mm.
having any pelvic floor issues, you go see a pelvic floor physio before you start running.
Awesome. Well, you're a wealth of knowledge. We could keep going, but we're at time. So I appreciate you for entertaining my wild and wacky idea of voice and pregnancy. And I think we have so much, I know we have so much juicy information on this that people are going to really be thankful for. So thank you for being here.
That was super fun, and I was
It's
like, "I
super
can't
fun.
talk about this for this long," and look, we did.
We totally
So
did.
great. Yeah.
Gal pals, right?
Hey, Jill, thank you for
Yeah.
doing this work because I think it's so
Mm,
important getting good information
thank
out
you.
there, right? And,
Yeah.
it was such a pleasure to see you and talk to you again. And
Oh, thank you,
I
honey.
got a sneak peek of Sean and the kids before we
Yeah, I
started this,
know.
so it's so nice to
I
see
know.
them.
Well,
They're
we'll
getting so
connect
big.
more because there's lots more that we can even deep dive into during our conversation. So we'll connect. But best of luck with everything you do. And thank you again for being on my show.
Thanks, take care of yourself.
Bye, love. Well, I hope you found that as fascinating as me. I have to fix my hair now because I was so who cares what I look like? I was so fixated on the beautiful Dr. Power that I was on another planet with that. But thank you for joining us. This has been so amazing. Oh, she's like, so much fun. You look fabulous in a private chat that you guys can't see. So thank you for coming out at the end. But hopefully you found some really fun information. This is really, really important. Our body is our instrument. The voice is not separate from everything else, even though we talk as singers or as public speakers that it is. That's just to segregate the studies a little bit more so we can fine tune our studying. That's not because it's completely separate. Mind, body, soul, it's all there. Voice is in the middle. So I hope you've enjoyed the episode, and we will be in touch with a lot of really fun episodes coming up. You can always find that out on our website at voxsana.co or our Facebook at voxsana.co. But specifically, our YouTube channel has all the upcoming notifications. So subscribe to the channel and get notified of all of our shows. Until next time, everybody, I'm going to be my own producer here. And we're going to do an outro. So take care, everybody, and we'll see you soon.